Good afternoon, ladies and gentlemen. Good afternoon to all of you who are listening to us now. A special greeting to our moderator, Daniele da Silva.
Saúdo também os integrantes desta mesa.
Okay. And so I would also like to greet the members, the other panelists here from Aparro in Brazil, Ms. Socorro, the Secretary of the Ibero-American General Secretariat, Maria Urbano, and I would also like to greet Dr. João Aprígio, because he gave us a very comprehensive view of the international coordination opportunities, the history of the HMBs in Brazil. And I would also like to greet all of the other authorities and participants who are taking part in such an important event. And we are all here connected virtually about international cooperation. And so it's a great joy and satisfaction for me to start talking to you about the international cooperation for the sustainable development of our countries, mainly in favor of global health. So since the beginning of 2020, the world has gone through many important social and economic transformations due to a never seen before pandemic, at least not in the recent history. The challenges that we still see in the near future invite us to think about international cooperation to try to face huge catastrophes such as the health emergencies that we're having now regarding the COVID-19 pandemic. And so we would like to strengthen our national healthcare systems. And this unified healthcare system in Brazil is very valuable to ensure to all the healthcare that they need, universal healthcare
nos âmbitos multilateral e bilateral.
And it's very important for us to have that as
os direitos garantidos pela Constituição do Brasil em seu artigo 6º.
And so healthcare
em consonância com esse compromisso
is a right guaranteed by the Brazilian Constitution, okay?
A garantir o acesso universal a serviços de saúde de qualidade à sua população.
And so our population has the right to receive health care. And so the Minister of International Relations, Carlos Alberto França, said that we need to emphasize and take care of our health. It's one of the urgencies, and the international relations policies has to face this, the urgency of the pandemic, the urgency of the economy, and also the urgency of having sustainable development. This agenda was highlighted by Chancellor Franco França in his recent participations at the Senate.
The center of what we announced as health diplomacy, where he showed his personal engagement. That's why also health is a predominant aspect in the Brazilian technical cooperation. The country, given the positive partnership between the Ministry of Foreign Affairs and the Ministry of Health, and why not to say the Ministry of Foreign Affairs and the Fiocruz, is one of the main diffusers of technical cooperation in the world. So cooperation in this area represents 14% of our cooperation initiatives and in benefit of other countries in development. 333 cooperation actions carried out in 62 countries of Latin American country, Africa, and Asia. Ladies and gentlemen, do allow me to remember that the Brazilian Cooperation Agency, which I have the honor to direct, is the one that is responsible for coordinating, negotiating, implementing, and follow up and evaluate at the national level the cooperation for the development for all areas of knowledge, be it received from other countries or international organisms, or offered to other countries by Brazil. I like to report that in 2017, ABC was also responsible for the coordination of humanitarian aid of Brazil, donations of medication, food, and other essential items are part of this humanitarian effort of Brazil to help countries that are having environmental disasters, public calamity, armed conflicts, or any other grave emergency, which is even more significant during this persistent pandemic that we are going through. I think Brazil believes that that technical cooperation cannot be substituted. It's a significant instrument to promote development with objective of strengthening local capabilities through human resources, training, and experience. So through these efforts, joint efforts, in the ABC, we are willing to implement endogenous local solutions adequate to the challenges of each country. Now, Brazilian technical cooperation has in its criteria of the implementation of projects the 2030 Agenda for Sustainable Development Goals of the UN. And by effect, our annual work for 2021 demands the clear indication of the objectives of development of the 2030 Agenda that orients the implementation of each project within included. I would like to highlight the important role of the cooperating agencies, public and private, all centers of excellence in their respective activities, as is the case of the Oswaldo Cruz Foundation called Fiocruz. I believe that the experiences shared abroad through the projects of international cooperation have contributed to identify problems and to build solutions that are innovative and that are common to Brazil and our partner countries. A beautiful and emblematic example of that is the cooperation developed by Brazil in the human milk banks area. Cooperation, integrated work by Fiocruz, the Ministry of Health of Brazil, and the Cooperation Agency, this low-cost technology with a technical body with a great social impact was already shared with 23 countries of South America, Central, and Europe. It's never enough to emphasize, it's a Brazilian creation. We should be proud of this. In 1943, the first human milk bank was installed in Brazil. And in 98, like our colleague mentioned, João, the Brazilian network of human milk banks, by initiative of the Fiocruz and the Ministry of Health, and currently reach 224 units in all units of the Federation. The objective of the network is to protect, support, breastfeeding, and collect and distribute human milk too. The action also seeks to reduce mortality. With the data of Fiocruz, 160,000 liters of human milk are distributed every year to low-weight premature babies in all neonatal maternity wards as well. And this Brazilian policy, this Brazilian structure came from 96 onwards. The letter of Brasilia already mentioned this, that defined the commitments for the internalization of HMBs. And like our colleague, we are reaching the dimension of BRICS. We are transforming the network in a direct collaborator of PAHO and the World Health. Soon we will be able to receive more information. And ABC started to coordinate together with Fiocruz a process of coordination, interinstitutional coordination, to take the Brazilian experience to other countries. The expansion of the HMB networks was highlighted in the South-South Brazilian cooperation, and that this space, I like to remember our dear Maria Alban. She immediately gave us succor to put these beyond the borders of Brazil. So it's very just that Maria Andrea is here for our Ibero-American cooperation. She would remember that still in 2007, with the Ibero-American meeting carried out in Chile, approved the creation of the program, Ibero-American HMB program. She can also remember that in April this year, by decision of the 27th summit of state leaders carried out in Andorra, the HMB program was converted into a project beyond the Ibero-American collaboration that will allow renovation of its important contribution to reaching the SDG objectives in the Ibero-American sphere. In the African aspect, that was also mentioned here by Prisho, another reference, the community of Portuguese-speaking languages, of which we are a founding member, and in common with other community actions of greater success, the HMB of the CPLP. This initiative, recognized by the UN as a successful example of South-South cooperation through its use in preventing deaths of newborns, expanded very quickly to all continents, resulting in the creation of what we nowadays call the global network of HMBs. So it's with great joy that I can say that through this global network already benefited 3 million of newborns have been benefited. 30 million women that had the opportunity of being able to keep breastfeeding their kids due to the assistance action carried out by the network. This cooperation constitutes not only a strategic of global reach to reach the SDG objectives, to relate it directly to health, but also a reinforcement, very important, for food security and for the reduction of all kind of malnutrition, which is one of the central of the other UN agencies' objectives, which is the FAO. The global network positively impacts because very early in global health. So all of these are purposes that orient also the PAHO, a regional that is leader in health in the Americas, a privileged partner of the Brazilian government through the Ministry of Health, whose representative in Brazil, Ms. Socorro Gross Galeano, is also here in this event. From the ABC's part, I would like to talk about the renovation of our commitment that we will build innovative solutions for the enormous difficulties that mark this challenging moment and without precedents that we're going through, together with our valuable partners facing this pandemic. And at the same time, we will be implementing the measures necessary to continue to execute the usual cooperation projects that have not stopped developing their activities despite this new challenge and environment. The initiative of the Human Milk Bank networks shows that the South-South cooperation promotes and stimulates the exchange of knowledge, the learning through lessons learned, and the diffusion of best practices, which are added local ingredients specific to each environment where the unit is developed of these HMB networks. The global HMB network, due to its characteristics of highlights and results, is a concrete example of the vigor of the principles that govern Brazilian international cooperation and diplomacy. The solidarity so necessary in this current moment of the pandemic, the horizontality, the mutual benefits, the appropriation of the initiatives by the beneficiaries, the respect for national sovereignty of each country, and the non-interference in internal affairs of countries involved. The global network is therefore a foundation stone of the articulation of states for global health and sustainable development. This event joins us here in what else can we do? In the global network, we understand here at ABC that in fact, we should do more of the same, more of what brought us here 80 years after we started. The pandemic itself puts us challenges that bring us or push us toward innovations because it deals with the new demands that we have to deal with a new view as regards our big projects, our great projects. For example, on the quality of the product, quality of the management of these units, among other challenges that maturity brings us. Thank you very much for your attention and your patience. Thank you and good afternoon.